time to take my medications. I'm not sure what this one's for. I don't want to take it. Maybe I should call my doctor.
Hello, you've reached the office of Cleveland Geriatrics. This is Lauren speaking. How can I help you?
Hello, my name is Laura Schubert, and I'm calling in regards to a certain prescription your office prescribed to me yesterday. I'm just not sure why I'm on it or why I should be taking it. I need some clarification when and how.
Okay, who did you see yesterday?
Oh, I saw a nurse practitioner. I'm sorry, I really can't recall her name right now.
Could you please give me your date of birth and I'll look up who you saw?
Yeah, sure. March 31st, 1936. Thank you so much for doing this. Sometimes it's a little hard to remember all the instructions because I'm on so many medications.
That's very understandable. You saw Maddie, and I see that she prescribed you some Lasix. Is that the medication you'd like some clarification on?
Yes, that's the one.
Alright, I'll notify Maddie right away, and someone from our team will call you back within the hour. Also, I suggest you hold off on taking your Lasix until you hear back from us.
Great, thank you so much. I look forward to hearing from you. Bye-bye.
Bye.
Hello, Anne.
Hi.
I just spoke to Lauren and she told me that Mrs. Schubert called about her medications, and I think it's a good idea as a student to do some patient teaching about them. She just can't remember what all of them are for.
Okay, what is she taking?
Well, I prescribed Lasix for her.
Those are loop diuretics, right?
Yes, and so what should you plan on telling her about?
They're to help with her hypertension. She will notice that she'll have to urinate more often and the color will be lighter. She should also notice that her blood pressure should decrease.
And what about some common side effects?
She could experience dizziness, lightheadedness, electrolyte imbalances. I forget.
Well, if her potassium levels drop, she would experience dry mouth, increased thirst, irregular heartbeat, muscle cramps, nausea, vomiting, and fatigue. And with the sodium level decrease, she would have confusion, irritability, also muscle cramps, and also an unusual fatigue and weakness. What about any adverse effects?
She could experience fainting because of orthostatic hypotension, and Lasix can also be ototoxic, which would cause hearing loss, but that's reversible when she stops taking the drug.
Is there anything special you need to tell her since she's an older adult?
Yeah, she will be more sensitive to the side effects, so that she may be more likely to fall, which means that she should have someone help her around, and to change positions slowly. And older adults are more likely to develop blood clots, so she needs to give us a call if she feels any muscle weakness or cramps in her leg. She also needs to let us know if there's any change in hearing.
Okay, and also don't forget to tell her to wear sunscreen because her skin is probably going to be a little bit more sensitive to the sun. And also she should probably try and eat some foods that are high in potassium like bananas.
Okay, I'll give her a call and let her know.
And I'll be right there if you have any questions.
Okay. Hi, Mrs. Schubert. This is Anne calling from the Cleveland Geriatrics office. I wanted to talk to you about your Lasix and answer your questions about the medications your doctor prescribed. Could I have a minute with you? Okay, great.